Single Subject Experimental Design by Sarah Reedy. What is a single subject experimental design? It's a type of quantitative research that studies an individual or small number of participants administering an intervention and monitoring the behavior of the individuals before, during, and after the intervention. If using a small group, there should be no more than 8 to 10 participants. There are 4 main types of single subject experimental design. Reversal design, also known as ABA design. In the ABA design, A refers to the no treatment or control phase of the experiment. B refers to the treatment phase. During the first phase A baseline is established for the dependent variable. This is the response before any treatment is introduced. This makes the baseline a control condition. When a steady response is reached, phase B will begin. The research will introduce the treatment. Just like the baseline, the researcher will wait for the dependent variable to reach a steady state to truly be clear whether and how much has changed. Lastly, the researcher removes the treatment and again will wait until the dependent variable reaches a steady state. Multiple treatment design. This is similar to the ABA design. In the multiple treatment design, a baseline is followed by separate phases in which treatments are introduced. An example would be a researcher may establish a baseline of studying behavior for a behavioral student. This would be A. Then they would introduce a treatment involving positive attention from the teacher, B, and then switch to a treatment involving a mild punishment for not studying. This would be C. The participant then would be returned to a baseline phase before reintroducing each treatment, sometimes in the reverse order, to help eliminate any carryover effects. This design could also be known as ABC, ACB. Alternating treatments design. 2 or more treatments are alternated quickly on a regular schedule. An example of this would be a positive attention for studying could be used one day and a mild punishment for not studying the next day, and so on. Or one treatment could be utilized in the morning and one treatment in the afternoon. The alternating treatment designs can be a quick, effective way of comparing treatments, but the treatments have to be fast. Universal. Using the reversal design, there are 2 potential problems to be aware. These 2 problems involve the removal of the treatment. What if the treatment is working? This could be unethical to take it away. An example of this would be if a treatment was working to reduce the incidence of self-injury in a developmentally disabled child. It would be unethical for the researcher to remove the treatment. Or, when the positive attention for studying is removed, a student might have increased the study at an increased rate. Could this mean that the positive attention had a lasting effect on the student studying? This would be great. But it could also mean that the positive attention was not really the cause of the increased studying. What if something else happened during the treatment? Did a parent reward or punish for good grades? To help with this, common problems is the use of multiple baseline design. Multiple baseline design. In this method, a baseline is established for several participants, followed by the treatment. Each participant is tested using the AB design. The difference in this design is that the treatment is introduced for each one at different times. That way, if the dependent variable changes, when the treatment is introduced for one participant, it may be a coincidence. However, if the dependent variable changes for several participants, then it's more than unlikely to be a coincidence. So what questions does this address? What questions With clinical applications, the focus is on the therapeutic value of an intervention for the client. And with literacy and language education, it can help inform practice and to help push our thinking and our theories about literacy development. With both clinical and classroom settings, the single subject design provides an efficient strategy for examination. What is the uniqueness of a single study? Every single subject study involves at least one baseline and one treatment condition. The baseline refers to a period of time in which the target behavior, the dependent variable, is observed and reordered as it occurs without a special or new intervention. The baseline provides the frame of reference where all future behavior is compared. Because as humans, we vary our behavior from day to day. The participants must have various opportunities to participate to show a typical response. Most researchers will recommend 3 to 5 data collection points during the baseline. An example of this would be a researcher wanting to examine the effects of an intervention designed to promote fluency. Before the intervention, a baseline would be established of the fluency rate of the student. Fluency assessments would be administered for several days. The baseline assessment would continue until the researcher could have the stability of this target behavior, which would be the fluency rate. The treatment condition is a period of time during which the experimental manipulation is introduced and the target behaviors continue to be observed and recorded. Repeated measure. In most experiments, the dependent variable is measured once. However, repeated measures are needed to obtain a clear pattern of behavior over time. In regards to the literacy fluency research, if the participant fluency rate increases and stays at that rate for 4 or more trials, they would have evidence that the treatment was successful. Single variable rule. In a single subject experiment, only one variable is manipulated at a time, and this allows research to truly see the impact of a variable on the outcomes. Internal variable rule. In a single subject design, the repeated baseline measurements allow the researcher to discount more threats to the internal validity of the design. An analysis of data. With a single subject experiment design, visual analysis is utilized with statistical analysis. The visual aspects, like graphs, show repeated measurements and allow for continuous analysis of performance. There are no objective measures like levels of significance. The researcher makes that decision about the benefits of the intervention based on a visual inspection of the data. And lastly, the conclusions about intervention can be made quickly. If there is evidence of maintenance, the research can discontinue the study and implement the strategy. External validity is one of the most controversial aspects of the single subject experimental design. How can one determine if the results found can be applied to others? Some researchers use the words generalizability and transferability. Generalizability means that we can't worry about a generalized intervention. If something works for one, we have evidence that that treatment worked. And with transferability, we can apply the same research to different participants with different characteristics than the first study. And this could help establish credibility if they experience the same results. So what are some strengths? Strengths of single subject methodology. Some of them include, instead of comparing the percentage of people to an experimental factor to the percentage of people who did not, the study examines how an individual subjects respond to the experimental factors. It's also cost effective. In an experimental group, the researcher has to find a large number of participants. This requires the time and resources to not only gather the participants, but to run trials of the experiment on all of the subjects. With single subject experimental design, the researcher can quickly design and run their study without having so many participants. You can also evaluate the intervention prior to a large-scale study. which would save lots of money. Reliability. Because behavior is assessed repeatedly, the single subject design allows the researcher to see how consistently the treatment changes behavior over time. Large group statistical designs do not typically provide this information because repeated assessments are not usually taken and the behavior of individuals in the group are not scrutinized. Instead, the group means are reported. What are the limitations? A carryover effect. This is when an effect that carries over from one experimental condition to another. Usually within a single subject design, a subject participates in more than one condition. And due to this, there is a possibility of carryover effects. For example, think about an experiment of the effect of rate of presentation of memory. Subjects are presented with a list of words, and they have to recall as many as they can. In condition, the words are presented 1 word per second. In another, the words are presented 2 words per second. The question is whether or not having performed on condition affects performance in the second condition. Did learning the first list of words interfere with learning the second list? Or did the practice with the first list make it easier to learn a second list? This would result in the carryover effect. The performance on the second list would be affected by the experience of being given the first list. Generalizations. A limitation of a single subject design is the difficulty of generalizing the results to other subjects, and this is due to the small number of subjects that were investigated. Absence of statistical scores. A single subject design does not provide researchers with a set of scores from a group of subtests. Instead, the presentation and the interpretation of results from a single subject are based on a visual inspection or a simple graph. So what should we look for to look for a good quality single subject design? A single subject method should be a rigorous design if used correctly. Here are a list of 6 indicators that should be considered when designing studies. Descriptions of participants and settings. The participants need to be described with complete detail for others to duplicate the experiment. Independent and dependent variables. The independent and dependent variables need to be defined. With the independent variable, the researchers need to identify a behavior that can be manipulated and powerful enough to show immediate effects, while the dependent variable is important to use for a valid and reliable measures that can be measured over a repeated amount of time. Baseline. Baseline behaviors must be measured over a sufficient period of time in order to show stability prior to the treatment. Experimental control. The design must control for common threats to internal validity, like testing effects over multiple treatment interference. External validity. Experiments should be replicated across participants, settings, and/or materials. Social validity refers to the social importance and acceptance of the goals, procedures, and outcomes. Researchers look at the magnitude of change in the dependent variable as a practical value general importance. Here are some references to learn more about the single study design.